Hospital admissions have declined by over 50%, mainly due to a decrease in the utilisation of health services as a result of the lockdown and surgeries that have been put on hold. This is according to the Board of Healthcare Funders. This is a body representing 52 of the country's medical schemes. According to the body, the average cost per COVID-19 admission is about 150,000 rand per patient. Medscheme, for example, has spent about 14.5 million rand on 97 admissions related to COVID-19. GEMS has allocated about 900 million rand for COVID-19 treatment this year and this financial year. Now, these costs are expected to increase based on the projections of an upsurge in coronavirus infections. Dr. Katlego Mothudi is joining us now. He's the Managing Director of the Board of Healthcare Funders, and he is joining us via Skype. Thanks so much. Great to have you on the program, Dr. Mothudi.
Thank you, Leanne, and good morning.
Are you able to make a comparison that gives a perspective when looking at the current cost and the previous financial year around this time when there was no COVID-19?
Yes, it is possible. I think some of the schemes have already looked at that data, comparing the time from around March. What they report is that, firstly, the length of stay with respect to the current admissions has increased somewhat. They are saying it's north of about 5 days, although previously length of stay was a bit shorter, some reporting around 3 days or some just under 4 days. The second thing is that the type of cases that they are seeing obviously has changed. This one's specifically COVID related admissions are respiratory infections, while for the previous years it's been quite a broad spectrum of admissions. And also the level of care, you're seeing a swing towards a higher level of care. So you're seeing a lot more high care and ICU patients being admitted. And the cost as well, one of the schemes is reporting that the average that they had was around 30,000 rand per admission. And we've reported, I think this brief that we released around 2 weeks ago, around 150,000. We do expect variations per scheme, and also as the disease increases in terms of incidence, the figure will vary.
How much do these schemes collect annually, and what normally happens to the unused funds that have been allocated as benefits for that year?
So the Council for Medical Schemes reports around 180 billion rand collected in terms of contributions. And they also then report that close to 90% of that money is actually used in healthcare services. That varies as well. The other 10% or even more sometimes is used for admin services and other expenses that the scheme incurs. For those schemes that are able to report surpluses, this money is then put into reserves. And you may know that it is legislated that schemes must actually save up to about 25% worth of reserves. This is equivalent to about 3 months contributions, just to act as a nest egg for times like this, or when the claims experience is not too favorable for schemes.
I mean, medical scheme members generally feel that there's injustice when it comes to medical aid fees. I mean, for the most part, most people hardly even use the sums allocated for certain benefits such as operations and hospitalization. So, and especially in a time like this where you're finding that, you know, as we're reporting, hospitals are empty. Normal practitioners are not working the way they used to. I mean, suddenly people are scared to go out unless it's COVID-19 related.
That is true. So in terms of the expenses now, the schemes have reported a decrease in the claims experience. However, there is a warning that is sounded that often when there's a crisis or something that disrupts the community, we do see a downswing in terms of the claims. But however, there's usually some sort of a rebound phenomenon afterwards. And a perfect example is around 2010 when we had the Soccer World Cup. Most schemes reported a reduction in claims experience. And as soon as the euphoria had passed, there was almost a compensatory claims experience. Now, this is sort of what is being projected as well, because there is anxiety and also a reduction in the health-seeking behavior of beneficiaries, and they don't claim. There was an expectation to see a reduction in the surgical procedures. One, because deliberately some of the schemes on the back of what government announced around electives, some took a decision to push them back. What was surprising, though, around the medical admissions, because the schemes also report a reduction in admissions for diseases like diabetes, asthma, hypertension, and even mental health disorders. And that is concerning because the pandemic may be inadvertently reducing access to healthcare services. The second thing that is of worry is that some of the schemes have reported some reduction in chronic adherence to medication, also follow-ups for pathology reviews. For example, those people who are HIV positive have to go for regular viral load testing. There has been a reduction in that. So in as much as there has been a reduction in the claims experience, there might be that rebound, but secondly, there might also be an increase in complications related to people not seeking care that they require.
Dr. Mothudi, just to find an important aspect here is that current situation is that some people have lost their jobs, they cannot pay the medical schemes. Has there been a payment holiday at all for people that are on medical aids? I mean, under normal circumstances, medical schemes don't admit people who don't have funds, considering that premiums are payable on a monthly basis and some people can't or have not paid. What happens? I mean, this is something I imagine that's been considered.
No, definitely. I think right about early March, when the pandemic was starting to hit our shores, there were extensive discussions with the regulator and various schemes to consider financial reliefs for their beneficiaries, and also on the back of what the banking industry offered in terms of debt relief. The issue of the payment holiday was considered. However, it's not as easy as maybe it appeared in the financial sector, because firstly, the financial or the relationship between the member and the scheme is defined by contributions in exchange for healthcare services. And as I said earlier, these contributions then eventually, if there's any surpluses, land up as reserves. So it is important to have ongoing income. Now, if any scheme were to offer all its members a payment holiday, the issue of sustainability will come up very quickly. Most schemes would actually collapse within a few months if they do not collect any contribution but continue to pay claims. So a payment holiday was one of the suggested solutions, and some schemes had said that they would offer a holiday but not terminate services. However, during that time there would be limited benefits that are offered. Other things that were considered by schemes, those that have a close relationship with employers, for example, had a discussion quite early on, and the employer groups, some have volunteered to increase the contribution they make on behalf of the beneficiary. The third one was around ability to downgrade your option. You may know that for every scheme, usually there's only one chance, either at the end of the year or at the beginning of the cycle, to change your benefit option. Some schemes have said that they would make it optional for their members to downgrade during the year. And I think it's important to note that even if people downgraded their options, they would still have access to benefits because COVID-19 was declared to be what is referred to a prescribed minimum benefit condition, which means that you have access to services and the scheme is obliged by law to pay for certain services that are deemed to be clinically appropriate.
I want to carry on, but we've got to leave it. We're already into the news now. Dr. Katlego Mothudi, who is the MD of the Board of Healthcare Funders, talking to us about a shift brought about by COVID-19 in the healthcare sector, but also what medical aid companies are doing during a time like this, which has seen a 50% decline in general hospital admissions, while COVID-19 related illnesses are anticipated to increase and overwhelm the healthcare system. All right, we've gone way into 8 o'clock.